Hi, everyone. I just wanted to record a quick info session in case anyone missed our previous information sessions about the CLARION case competition and wanted to learn a little bit more about it. So my name is Allie Weedman. I am one of the co-directors for CLARION this year, and I am a second-year Master of Healthcare Administration here at the U. So just to give a quick overview of what this presentation will be, I'll try to keep it short, but I'll introduce who CLARION is, what we do, why you might want to compete in the CLARION case competition, how it works, the timeline and logistics, and then I can talk a little bit about my experience participating last year. So CLARION, we are a professional student organization here at the U, and our kind of ultimate goal is to encourage students to collaborate amongst our different graduate health professional programs and to really learn those interprofessional leadership and teamwork skills so that ultimately when we go on to go work in the healthcare workforce, we're prepared for what that really looks like so that we can solve some of those bigger systemic healthcare issues. So CLARION, we put on a variety of programming. Our case competition in the spring is our biggest program, but we also have things in the fall. For example, this past fall, we had an interprofessional dinner where we had a panel of interprofessional guest speakers talk and had, some activities for our student participants to do. Some other things, so our case competition is our biggest event. So we have a case kickoff for the local competition and then the local competition itself. And then the national case competition where teams from schools around the country will also participate and one student team from the U will go on to participate. So basically how the competition works, each individual student will register on their own and then they would next attend our case kickoff, which is being held this Saturday, January 29th. And this is where we'll release the case study, talk about the rules, and you'll get to meet your teams. So our student board, the CLARION student board, will randomly assign teams. So that's why you register individually. And then over about 3 to 4 weeks, you'll work within your team, which will consist of 3 to 4 students total. And you'll work on this case study and try to come up with an innovative solution to the problem that's presented. And then ultimately on the day of the local case competition, you will present your final recommendations to a panel of judges. And at the minimum, you'll be presenting in the first round, and then the top 3 to 5 teams will then go on that same day to present again in the final round. And then just something fun, our top 3 winning teams will win cash prizes, and then our top team will go on to advance to that national case competition that I was talking about, and will compete in April against students from other schools. So the event format, so this year we're very excited to hopefully be offering this event in person again. This is how it's been held historically, but obviously because of COVID, it was transitioned to virtual for a couple years. So at the moment, we're planning on having it in person. With that being said, we'll keep all COVID-19 precautions in place and do everything we can to keep you guys safe. And of course, depending on how the COVID situation looks, we reserve the right to transition to virtual if we need to in order to keep people safe. But this will be held at HSEC on campus, at the Twin Cities campus. And then we're actually hoping this year, which is pretty exciting, to have our final round be streamed online. So if anybody that's presenting has family or friends that want to join and see what they've been working on, they're more than welcome to do that. We're also going to open it up to some of our undergraduate pre-health students so they can kind of see what it's like, what the things that they might get to participate in if they were to continue on here at the U, that kind of thing. So a little bit more about the teams. So like I said, the teams will be randomly selected by our CLARION student board and advisors, and their teams of 3 to 4 people. And so there will be at least 2 professions represented on each team. We don't want any more than 2 students per program on a team. So actually we try to get it so that every person on the team is from a different program, but sometimes the numbers don't work out perfectly, but you'll never have more than 2 from your same program, and you'll have at least 1 other program represented. And like I said before, this is open to graduate level health professional students. So just an example of what this case competition has looked like in the past. Here's some of our past case topics. So in 2019, it talked about homelessness as related to healthcare access in Hennepin County, and the students had to come up with innovative solutions and how to incorporate housing into the healthcare system. In 2020, the topic was clinical and administrative collaboration to diminish maternal mortality disparities in southeastern Wisconsin. So that was targeting a relevant issue in that region and coming up and trying to look from an interdisciplinary perspective about how to solve that. Last year, which was the year that I participated in, the topic had to do with a family that was displaced by natural disaster in Puerto Rico and moved to Orange County, Florida, and really how to provide them with all the support services they need to assimilate into their new life here in the US. And then this year, we're very excited to announce that our topic is solving for burnout, a focus on belonging in healthcare teams and organizations. So obviously very relevant to everything we're seeing right now. So a little bit of a COVID focus, but you know, it's even broader than that. And I think this will be a really interesting topic. I don't think any other case competitions that we've heard of have really explored this topic before. And it'll be interesting for you guys to all get this experience learning about this topic before going on into the healthcare workforce. So just to kind of give you an overview of the different programs that participate in the interprofessional case competition. So we have, I think it's over 15 programs that participate. So from a wide variety, anybody is welcome. We really want that diversity of thought and perspective and experience to come together, because that's really what makes the solutions come to life and make them realistic, because, you know, we know that we're thinking about it from all our different lenses and really utilizing the strengths of all of our different programs that we have here at the U. So participating in the CLARION case competition is an awesome way to develop some skills and get some experiences that you might not otherwise get in just your classroom setting. So this is an opportunity to solve kind of a broader, complex public health and healthcare issue. So this is probably more realistic to what you might see once you're out working. And really getting to work on a team of interdisciplinary health professions that, again, I don't know about you guys, but for me in the healthcare administration program, most of my classes take place only within our program. And so I mostly get to only interact with students from my program. And so, and that's not necessarily realistic all the time, because, you know, once we go out and are working, teamwork and collaboration is huge. And so this is just a great opportunity to really start to develop those skills. And then ultimately you're coming up with an innovative solution, and like I said, a realistic setting. And then you're going to be developing a lot of different skills that you might not otherwise get. So some of the supplemental benefits, this fulfills some of the IPE scholars requirements, if that's something that you guys are participating in. And then, like I said, there's also potential for a cash prize for the top 3 teams that win our local case competition, as well as that one team that will go on to participate in the national case competition. There's also a cash prize for those winners too. So now I can just talk a little bit about my experience and kind of the benefits that I gained from participating. So I obviously really enjoyed my time, considering that I came back to participate as a co-director for CLARION this year. So I was on a team of 4. I'm a healthcare administration student. I also had a public health student, a dental student, and a nursing student. So we all came from very different backgrounds. And it was really interesting to see, kind of right when we got the case released, to read through it and talk about kind of what each person really pulled out of it, even just after an initial reading. And it was so different, and it was so interesting to see kind of what jumped out at each person given their education and experience. And then from there, trying to figure out what everybody's unique strengths were and how can we leverage that to ultimately come up with a well-rounded solution. And so I think that was probably my favorite part, was just getting to meet and work with students from other programs that I otherwise would not get to interact with very much. But, you know, I also developed a lot more skills. So I mean, I get to present sometimes in my classes, but I know that not all of our health programs at the kind of incorporate presentations. And so this is a really good opportunity to get to do that for a lot of students. And time management, I wouldn't say it's a huge time commitment. Most teams probably work about 5 to 10 hours per week on the case over the course of the 3 to 4 weeks that it's released. So it's not a huge time commitment, but it's definitely something that you need to learn to manage. And I think that's also just a good life skill to have. And you really learn how to network with people outside of your program, because you might need to reach out to different professionals in the area and get their expertise to help kind of guide you in your solution development. So there's a ton of great benefits. I talked about this in my interviews for internships and fellowships. And so, I know that you guys will all have opportunities to talk about this as you move on through your professional career. And I think it just shows that you were proactively really trying to get that realistic, real life experience before you go out and start working. So like I said, I really enjoyed my time. And I think it was a huge benefit to me, considering that it was kind of pretty low stakes for an extracurricular activity, relatively low time commitment. And that's why I just really recommend participating if you're looking to get involved in some other way here at the U. So just an overview of our timeline. Today, January 24th, is our registration deadline. So please register by midnight if you're interested in participating. And then you'll attend the case kickoff this Saturday, January 29th, which will be held via Zoom. And this will be from 9 to 10 on Zoom. So it should be pretty short, nothing too crazy. And then you will present at the local case competition on Saturday, February 26th. So this is what we're saying. We're hoping to be in person. We're planning for it to be in person at the moment. And then that top winning team will present at our national case competition, which will also be held via Zoom on April 8th and 9th. So that's over a weekend as well. All right, so here, if you guys are interested, I know there'll also be a link in the email that gets sent out, but you can scan this QR code and register. We're also more than happy to answer any questions that you might have remaining. So feel free to respond to this email, it's the CHIP email, or to email clarion@umn.edu.